ABGs confusing? You're not alone. But here's the good news. You do not need to panic. When you see pH, CO2, and HCO₃, use this simple three-step trick and ABGs start making sense. ABGs made easy, respiratory versus metabolic. Let's dive in. An ABG, or arterial blood gas, helps us understand oxygen, carbon dioxide, and acid-base balance. For this video, we're focusing specifically on the acid-base part of that balance. Here are the three numbers to watch. pH tells you if the blood is acidic or alkalotic. CO, 2 points to the respiratory side. It tells us how the lungs are doing. HCO₃, also called bicarb, points to the metabolic side, handled by the kidneys. Step 1, check the pH. If the pH is low, think acidosis. This is our first clue. If the pH is high, think alkalosis. That tells you the overall direction of the problem. Step 2, check CO2. Remember, CO2 acts like an acid in the body. If CO2 builds up, the blood becomes more acidic. Think slow or shallow breathing. If the patient blows off too much CO2, the blood becomes more alkalotic. For respiratory problems, pH and CO2 move in opposite directions. Low pH, high CO2. High pH with low CO2 means respiratory alkalosis. They go in opposite ways. Respiratory acidosis usually means the patient is not blowing off enough CO2. Think COPD flares, opioid effect, oversedation, or airway fatigue. Respiratory alkalosis means blowing off too much CO2, often from anxiety or fever. Pain, sepsis, hypoxia, or early respiratory distress can also cause this shift. Step 3, check HCO₃, or bicarb. Bicarb acts as a base buffer in the blood. If bicarb is low, think metabolic acidosis. The kidneys are losing their buffer. If bicarb is high, think metabolic alkalosis. Too much base is building up. For metabolic problems, pH and HCO₃ move in the same direction. Both go down. High pH with high HCO₃ means metabolic alkalosis. They move together. Metabolic acidosis happens with too much acid or not enough bicarb, like in DKA. It can also be caused by kidney failure, severe diarrhea, or shock. Metabolic alkalosis happens with too much bicarb or acid loss from vomiting. Watch for NG suction, diuretics, or even low potassium levels as causes. Respiratory equals CO2 and pH moves opposite. Metabolic equals HCO₃ and pH moves with it. Quick recap: Step 1 pH, Step 2 CO2, Step 3 HCO₃. Pattern recognition is key. Lungs handle CO2. Metabolic problems follow bicarb. ABGs are a lot less scary now. Join us at the Nurse Scrub Club, where we make complex nursing topics simple, visual, and memorable.